Welcome to Medicine and Healthcare Around the World, the podcast where we connect with passionate people from all over the world that are making an impact within the field of medicine and health. So, if you're tuning in to listen to one of our many great stories from wherever you are and wherever you're headed, please be welcome, friend, as we're about to get on with today's episode.
Millions of Canadians have heart disease, putting them at high risk of a heart attack.
Studies have clearly shown that if you have symptoms of a heart attack, the sooner you can get aspirin on board and the sooner you start nitroglycerin, you're more likely to survive.
Nitroglycerin usually comes in a glass bottle.
The problem with the spray bottles is people don't carry them.
Medication's no good if it's sitting at home and you're having your heart attack at the football game.
Now, a made-in-Edmonton invention to treat heart attacks is getting national attention. The Canadian Medical Association Journal just published a scientific study of the SMHeartCard. The special container keeps aspirin and nitroglycerin stable in hot and cold temperatures for 6 months, so the pills can be carried in a wallet as emergency medication.
And that's the beauty of the SMHeartCard, because they keep the potency of the pill.
Thank you so much, Dr. Neil Davis and James Stewart, for taking the time in your busy schedules, I imagine, for doing this interview. So we'll go into the product that you guys have developed, the Smart Card. But before we go into that, could we just do a brief introduction of each and one of you? Now, Dr. Neil Davis, please, I want to make sure that the guests, that the listeners, they have been so helpful, these guys, in providing me with information and pictures and CV about this product, more than any other guests that I've interviewed. And, if we could do a guest introduction, maybe not as long as your CV, Dr. Neil Davis, that if I'm not mistaken, was 108 pages, the longest CV I've seen, a resume that I've seen during my whole life. But just a short introduction about your background, and then we'll move on from there. So if I may start with you, Dr. Neil Davis.
Hi, thank you very much for this opportunity today. I'm Neil Davies. I'm a pharmacist. I went to the University of Alberta and I graduated in pharmacy, and I continued on, and I undertook a Bachelor of Philosophy in Pharmaceutical Sciences from the University of Alberta. I moved on to the University of Calgary. I've looked at the University of Sydney in Australia, Washington State University, University of Manitoba, and now I'm back at the University of Alberta. And I'm still a pharmacist and a pharmaceutical scientist, and I do investigational studies in pharmaceutical sciences, formulation development, pharmacokinetics, kind of stability, portfolios tested. And, I'm really happy to be here today and talk about the Smart Card.
And I'm honored to have you here too. Thank you for that. And James Stewart, how about you? What is your background?
Well, first, thanks, Sam, for having me here today. I'm very proud to share with your listeners the story of the Smart Card. My background, I'm an engineer, graduated the University of Alberta in Edmonton, Alberta, Canada in 1989. So I've been a professional engineer for 36 years. And I typically have been involved. I'm the president and CEO of Motivated Ventures Corp. It's an engineering company that specializes in design and construction. And I'm an inventor. I've invented a number of things that have been patented and used around the world. So that's what actually brings me into the Smart Card, because I could see an issue with the nitroglycerin, and because I was an inventor, that's pretty much how I ended up gathering a team of doctors, a team of specialists to develop the smart card because I had an underlying reason to come up with the solution. So thanks so much for having me here today.
Yeah, again, the honor is all mine, and we'll get into the smart card. I think it's such a brilliant way of putting it. So for those of you that are listening and watching the video, I'll put the text. I'll put, of course, the product itself with a few pictures on it. But so it's not, as you would imagine, smart card in the sense spelled that way, but instead you have the SM and then heart card. And we'll get into that and the specifics of it. But I'd like to kind of maybe outline the conversation with a few things that might be, well, no pun intended, but the heart of the conversation. And that is the CVD, and so the cardiovascular diseases, which is in the Western world, according to the WHO, the biggest cause of death that we have. So in Canada, but also here in Europe, in the US. And it would make, so this includes, for those, not to get too technical with the terminology, but includes conditions like a myocardial infarction, what we call a heart attack, coronary artery disease, heart arrhythmia. So any disease that really revolves around the heart and its vessels. A huge health issue in our society, and due caused also to a lot of environmental factors like the lifestyle that we have, especially diet. So without making it too complicated, we have a huge issue with CVDs, cardiovascular diseases. And you said, James Stewart, that you were an inventor. I thought you put it really beautifully. And if we can start the story here then of the Smart Heart Card, because if I'm not mistaken, from what you guys told me, this was the kind of foundation, I imagine, that we have an issue with cardiovascular diseases and myocardial infarctions or heart attacks. So if I may start with a question directed to you, James Stewart, how did you get together? You said that you collected a medical team and started the work on the smart card. How, if we start the story, how did that begin?
Well, I've had family and friends who have died from heart attacks. So that was my motivation to come up with the solution. I spend a lot of time in the backcountry. I'm a cross-country skier. I'm a backpacker. I'm a snowmobiler and a quadder. Uh, uh, I have remote camps in the foothills of the Rocky Mountains, and I spend a lot of time there in the winter. And I used to always carry ASA and nitroglycerin with me in a baggie. Not knowing any different, I carried a suture kit as well, and polysporin and Surgicel. And if somebody got hurt, we're away from emergency care. I was going to do my best to get them home. And so I carried ASA and nitroglycerin in a baggie. And on one of these excursions, a fellow who came with me, he was studying nursing at Grant MacEwan College here in Edmonton, Alberta, Canada. And he asked me, he said, "What are those pills in that baggie in your first aid kit?" And I said, "Well, that's ASA and nitroglycerin." He said, "Oh, no, I know what it's used for. We've studying this in school." And he said, "That nitroglycerin, that's not going to have any potency." And I said, "Well, what do you mean?" And he said, "Well, nitroglycerin reacts with air and light and layers itself on plastic and metal. So you'd be better off eating the bag than taking those nitro pills because there'll be no potency." And that's really where this all began. So when I came back home, I actually looked into it a little more. What is nitroglycerin? Well, it's sulfuric acid, nitric acid, and glycerol. And I thought, well, if I'm going to come up with anything, and first I looked, there's nothing existed in the world. And I thought, well, this is not going to be that easy, because if it was that easy, someone would have invented something already. But when I looked at this, being an inventor and all, I thought, well, I'll have to come up with a material that doesn't react with any of these things. And in doing that, I thought, okay, A, I'm going to have to come up with a material, and then B, I'm going to have to prove to the medical world that those pills still hold their potency. So what happened, I knew I'd need some medical people. And what happened is I took the idea to Dr. John Mackey. Now, Dr. Mackey, he's a professor, he's a world-renowned researcher and scientist, an oncologist, and he develops cancer drugs. At the time, he was the director of clinical trials at the Cross Cancer Clinic. So, and he's a smart fella. And I took the idea to him, and it totally resonated with him because his brother had survived a heart attack, had been prescribed nitro spray from his cardiologist, but never carried the nitro spray because the nitro spray bottle is very cumbersome. How does a person carry the nitro spray? And so when I mentioned this to John, he actually was bought in immediately that, hey, let's do something. The nitro spray on its own is not that effective for a heart attack. Mind you, and the ASA on its own is not very effective, but the ASA with the nitroglycerin together are very effective. We did some research and we found a study that showed people who were prescribed nitro spray by their cardiologist, only 18% of women and only 11% of men actually carried the nitro spray. And that was one of the things that really pushed us in this direction to carry on. Now, we knew we had to test the product, and Dr. Davies is renowned. He, at the time, was the Dean of Pharmacy and Pharmaceutical Sciences, and so he would be able to test the product in his labs to ensure that the product, that the nitro held its potency. And so when we approached Dr. Davies, Dr. Davies felt, hey, we're going to save a lot of lives, and he was bought in right away. And so from there, it led to us bringing in a cardiologist, Dr. Ian Patterson. He's a professor. He's a cardiologist. At the time, he was the director of research at the Mazankowski Heart Institute, now the Ottawa Heart Institute he's at now. But we wanted to bring him in so he could explain to us, what cardiac patients need in a card and the best way to do this. So we proceeded together to find a material that didn't react with the sulfuric acid, the nitric acid, and the glycerol. And, so you start with theories as to why does the nitroglycerin not react with glass? Like, it comes in a glass bottle. It's supposed to be kept in that glass bottle, but why doesn't it react with the glass? And that's really where everything began with this team of specialists. They're the real specialists. And like I said, I've never done a medical project before, but the Smart Card has been such a success. I'm sure the team and I will do other things down the road. So, yes. So I hope I answered the question.
Yeah, more well, I'll be crossing my fingers for your future's endeavors here. Thank you for that, James Stewart. And so, we'll get into the details of this encasing and the smart card and what it looks like. Of course, like I said, I'll post a picture of it, of course, for those watching the video interview. But it is an encasing, and just to be clear on the terminology, when you have a heart attack, time is of the essence, of course, to get you to the hospital as soon as possible. And you mentioned the nitroglycerin spray, which in Canada, I just looked at I don't know if it's this one pharma company that has monopolized the making of it, but it looks exactly like the one we have in Europe, the red and white little flask. If I'm not mistaken, please correct me if I'm wrong there. And then you have the ASA, acetylsalicylic acid, that is, more common. We all call it aspirin, that is used. And so the nitroglycerin is what we call like a vasodilator. So if you have a heart attack, let's say to a blood clot that's coming into your system, And not, again, to get too technical with those listening that are not too familiar with medicine, but the clotting in itself causes what we call hypoxemia. So it's the kind of your heart doesn't get the necessary oxygen to function properly. And that's why time is of the essence. So the aspirin in this case helps to kind of unclot the clottiness, we can say. And the nitroglycerin works more as a vasodilator, so it kind of dilates your blood vessels. And so it's a kind of temporary relief for what is often the chest pain associated with heart attacks. So without me trying to babble too much here, I'll move on to the next question to Dr. Neil Davis. So when he approached you, James Stewart, with this, and we'll get into the the product itself in just a bit, but what were, according to you, when they started to look at testing this and developing in the lab, the challenges that you guys were facing when developing this product?
Yeah, it's a great question. So was Dr. Mackey and Jim Stewart came to my office and we started explaining, this issue and problem. And I listened attentively and sitting on the couch. And actually, I just kind of looked up, saw my pharmacy diploma on the wall. I took an oath here to help patients. What can I do? And I told them about, in the pharmaceutical industry, we do performance testing. Dissolution and stability of drugs is very important. You can have a great product, but you need to make sure that it's stable and that it will perform. And I had been involved in dissolution testing, so I explained, well, I think that's the way forward. We have to see, you have to do some studies on both the stability, and we have to look at performance. So we have to look at dissolution. And so I thought about the issue, and we proceeded to go from there to go into the laboratory right away. We got nitroglycerin tablets, and we began to conceive of what we had to do to ensure stability. Now, nitroglycerin is renowned to be unstable. So there's really two products here, both with very interesting backstories. Nitroglycerin, it's trinitroglycerol, or glycerol trinitrate, actually nitrating glycerol. And there's actually an Italian connection to this. It was about 179 years ago, a chemist, Ascanio Sobrero, at the University of Turin, he discovered and he nitrated glycerol. And it's about 1846. And, it was a little bit volatile. Its actions, it can be even explosive. And so nitroglycerin was used and it exploded. In fact, it killed a gentleman named Emil Nobel. That's where. And he was the brother of Alfred Nobel, the Nobel Prize. You might have heard of that. And Alfred Nobel wanted to stabilize nitroglycerin himself. And that's how he came up with dynamite. He mixed nitroglycerin with diatomaceous earth and a more sort of stable form to move around. And from that, he made his fortune, and then he gave it back to medical science. So we needed to stabilize this. It's unstable. Many drugs are unstable. In fact, aspirin over long periods of time is also unstable. And so we began the process of testing the stability at different temperatures, different temperature ranges. In Canada, it can get quite cold in the winter, so we had to actually go down to, minus 40. But it can also get very warm in the summer, so we have to test a long range of temperatures. And we had to look for ways of stabilizing it. And, to cut a long story short, we tried some different glasses and amber glass vials, Hunted nitrogen, merged with nitrogen. But the real invention here is polytetrafluoroethylene. It's the polymer. And this polymer actually, we put the nitroglycerin in this polymer, it seal it, and we didn't have any stability issues whatsoever. It's at least stable under various conditions of heat and temperature and lighting. It's very reactive to nitroglycerin, to both oxygen and to light. But we could stabilize it under this polymer for at least 6 months. We saw actually no issues. So this is really the invention. And then this was then patented and made into the smart card, which I think actually James probably has it on his phone right now. And yes,
Yeah, it's right here. So just right in there it is right there. That small. Carry it in my phone wherever I go. And you can see it's labeled ASA and nitroglycerin. I just show you. I'll pop the cap and just show you. There's 4 ASA in there. And on this side, there's 3 nitroglycerin pills. And like Neil said, the invention is what those nitro pills are sitting in. But the beauty of this is the instructions are right on the back. So if someone is having a heart attack, the pills are right there. And like I say, it holds 4 ASA, 4 ASA and 3 nitroglycerin pills. But if I was to read what it says, if chest pain starts, chew and swallow 4 ASA. So you'd open up the cap, chew and swallow the 4 ASA. What that ASA does, it starts to break down the clot and stops the clot from forming. But that takes a little bit of time. And that's where the nitroglycerin comes into play, because on the back of the card it says put 1 NTG under your tongue and call 911. What the NTG does is, while the ASA is starting to do its work, the NTG expands the arteries to let the blood flow get around the clot to your heart. Now, the heart muscle starts to die after 10 minutes of not having blood to it. So it's very, very crucial to get the ASA and the nitroglycerin to the heart muscle as fast as you can. Like I said to you before, both of these drugs, ASA and nitroglycerin used together, are very effective, but individually are not very effective at all. So, yes.
So for the listeners out there, for both the healthcare professionals and for patients, you might have some asthmatics out there. And of course, if you're asthmatic, you carry your inhalers, right? If you're diabetic, you carry your insulin. You might carry some sugar as well. If you are sensitive to have allergies to peanuts or hypersensitivity or anaphylaxis, you probably carry an EpiPen. But what we're finding is that people with cardiovascular disease, which is probably 1 in 2 Canadians have, some risk factors for cardiovascular disease. 40 million Canadians, approximately. Well, 80,000 have died of cardiovascular disease in the last year. But 150,000 have ischemic heart disease. 60,000 just in Canada had their first heart attack last year. It's the second leading cause of death. 50,000 people died of myocardial infarctions, heart attacks last year. Could we reduce this number or reduce the morbidity and the mortality if we carry healthcare professionals, first responders on planes. They're wearing the first aid kits, ASA and nitroglycerin. Yes, we can, and we should be carrying this, and it will. And we have published case report and case series showing that it has saved lives. Now, aspirin has saved lives for thousands of years. Very interesting. That's the other component. I talked about nitroglycerin. Let's talk about aspirin, ASA, acetylsalicylic acid. Okay, it was used from times of Hippocrates, the father of medicine, Pliny the Elder in Rome. It's been used in traditional Thai and Chinese medicine. Our indigenous people used willow bark. Willow bark, you get salicylates from willow bark. You made it in teas. So they used it in the ceremony at sweat lodges. In Alberta, the Cree, the Inuit, Blackfoot, used salicylates. It's a long tradition of use by our indigenous peoples, in traditional medicine. But then it was taken, these salicylates, sodium salicylate is quite bitter. And so there's a French connection to this. So sodium salicylates and this was mixed with acetyl chloride by a French chemist, Charles Gerhardt. He did this back in really the 1850s. But then came along. It was a little bit unstable, but he's the first that was recognized to form acetylsalicylic acid. Then came along Bayer. Bayer's was just a starting out pharmaceutical company, German pharmaceutical company, Bayer. And they developed over 30 years, they developed a process and the synthetic process to transform these salicylates that are in willow bark to acetylsalicylic acid. It was a gentleman, he was a pharmacist, right? Felix Hoffmann, and he's a German pharmacist. There's still a little controversy on, did he do it alone or was there some help from some other people? But it was in 1897, and he got acetylated salicylic acid to make ASA, what we know as aspirin, Bayer aspirin, that patent on it in 1899. Interestingly, he was the same pharmacist who acetylated morphine to make heroin. That's another story. But so the long backstory, and it's very effective. We think about it often for headaches, pain and fever and inflammation, but it is excellent at acetylating in platelets. Platelets have cyclooxygenase 1, and aspirin, ASA, acetylates serine 530 residues, okay, in cyclooxygenase 1 that's only in platelets, and it renders it inactive, and that's how we get the antithrombotic effects. Okay, it doesn't render it totally inactive. It does produce some 5 and 12 and 50 heats, but it actually stops the cyclooxygenase in platelets, and we have an antithrombotic effect. So the aspirin in the SMHeartCard has antithrombotic effects. The nitroglycerin has these vasodilator effects, and together in combination in the SMHeartCard, and they're there when you're having some chest pain. So you got to know the signs and symptoms. When you're feeling that sweating, clamminess, you're starting to get some chest pain, fatigue, is beginning of a myocardial infarction, a heart attack. If you actually have, minutes matter here. And if you have aspirin and nitroglycerin you can actually make a huge difference on your clinical outcomes if you take it as fast as possible before you present an emergency, before there's damage. Okay, so this is what I want all your listeners to know. You actually have the ability, if you have or someone you know has cardiovascular risk factors, carry ASA and nitroglycerin. One way the carrying is in the smart card, it could save your life, it could save the life of somebody you love, and it could save the life of someone you don't know. If you have it available and they're having a heart attack.
Just a quick break and we'll head right back into the episode. I must say, the smart card was a lot smaller than I thought. I saw it on the website. And, for those, again, watching the video interview, I'll put a picture of the product itself. But thank you so much, James Stewart, for showing it. It was a lot smaller, very, very portable, let's say. And I'm sure you guys thought of that when developing the product. It fits, in the size of your pocket, which is great. But it contains, like you said, 4 tablets of aspirin and 3 tablets of nitroglycerin. So usually, also for those that are not familiar with nitroglycerin, again, it comes in a fluid that you usually spray, like I think it was James Stewart that mentioned under the tongue. But in this case, of course, you put the nitroglycerin tablet under the tongue. And it's developed, the casing is made out of PTFE. Now that is also, I think, what they put in Teflon, the frying pan, the non-stick surface, if I'm not mistaken, too. And so if we may go into the product itself a little bit. Now we have talked a little bit about it, that there was, and you linked me, I'll, for those of you that are interested, I'll put it in the show notes, the 2 studies that has been made with the smart card in mind, specifically. But I believe James Stewart, if I may direct attention to you, talked about this in the beginning, that, and again, referring to the studies, that we have poor compliance with the patients. You said that, I think it was Dr. Davis that said that people that have diabetes carry the insulin or some kind of sweet substance, usually, it could be a sugar cube, in case they're going up and low or become hypoglycemic. But in the case of when you have a CVD, a cardiovascular disease, or you are more prone to have a heart attack, whatever the reason might be, there seems to be a poor compliance. People don't carry around the nitroglycerin spray or aspirin. And I'd like to ask James Stewart, if you know, because that was one of the studies was talking about, essentially, why that is that people don't carry that. Where is is there a mismatch between the information distribution from the doctor to the patient, or just that's just one of my thoughts thinking about it from a clinical perspective? But what is the reason for the poor compliance in this case, according to you, James Stewart?
The thing we found with this, even people who have had an event already, who have already had a heart attack, so they know that they have the risk factors, whether it be high blood pressure, high cholesterol, diabetes, obesity, lack of exercise, poor diet, they're a smoker, they're a drinker, or it runs in the family. Even though they have a risk factor, even though they've already had a heart attack, they don't carry the nitro spray that's prescribed because it's cumbersome. How does a man put that spray in his pocket to carry it with him wherever he goes? I hear these stories all the time from the people, all the time, who call me and thank me of this great product. And they say, before I'd have it in my coat pocket. Well, if they didn't wear that coat that day, they didn't have it. Or people would tell me it's on their bedside table. And I'd say, no, that needs to be with you, because, the thing people don't understand is it's the difference between life and death. And really, from what I've heard from the people who've used the card, it's the people who are left behind who suffer more than the person who died, because they're the ones who live with this. But the poor compliance has to do with the fact that this bottle is cumbersome to carry. That's why people don't carry it. And like I say, anybody with those risk factors, they should definitely be carrying, the ASA and nitroglycerin in some form. But here's the issue. Are you going to carry the bottle of nitro that it comes in? That's cumbersome too, right? That's the advantage the smart card has on anything, is the fact that if you attach it to your phone with the cell phone pockets like we do, if you have that cell phone, your compliance will be there. And like you asked the question about compliance and future studies. One of the future studies I'd like to see, I would like to see a study done of the cardiologists who prescribed the nitro spray for their patients. I'd like them to do a comparison study as to how many of those patients actually carry the nitro spray, and compare that to how many patients given out the smart card carry the smart card. And I can almost guarantee you the results are going to be swayed in smart cards direction, because attached to your phone, everybody carries their phone when they go anywhere, but they don't seem to want to carry that nitro spray because it is cumbersome to pack around with you. And all of this information to come up with the smart card, it's a fabulous product. But after we came up with the prototype, we presented this to the cardiology rounds at the Mazankowski Heart Institute. 30 cardiologists got to grill the team about the smart card, and they gave us some amazing ideas, and we actually implemented those ideas into the card. And so that's how that card got to be so good. And the other thing we did after we had a prototype, we passed that card around to many doctors, nurses, pharmacists, and they all had a kick at the can. How do we make this card better? So the product you're seeing here today, that card came about with the help of a lot of people. A lot of people. Look how thin this is. Like it's just a little thicker than a credit card. But the compliance we see is, like I say, what exists today is cumbersome. Now, I got to tell you, the nitro pills were on the way out. They were going to stop production of making them because nitro spray is prescribed to most heart patients. And I talk to the cardiologists all the time. It's surprising because when people use the smart card, we get a lot of calls from the hospital emergency room doctors who say, yeah, somebody used your heart card. They came into the hospital, or doctors' offices phone us to say, hey, one of our patients used your card, right? And
Amazing.
here's the thing. People are carrying this card because it's suitable. And like I say, one of the best things we did is we passed it around to a lot of cardiologists to say, how do we make this card better? And that's why, like I say, compliance is very poor. And I would like to see a study done comparing the smart card to what exists already. And the other thing too, the nitro spray is missing the aspirin. Like, there you go. So,
If I could interject here, one of the issues that I see and feel and understand is, if you're diabetic, you know you're living with the disease, and you have episodes of hypo and hyperglycemia. So you're acutely aware, and you're going to have your insulin, you're going to have your sugar with you, because you realize you could die without it. If you're an asthmatic, you're having episodes and you're having attacks, and you realize the necessity of having that rescue inhaler with you. And I think with a lot of people that are afflicted, suffer, in some respects is a silent disease, cardiovascular diseases, and they're not having those episodes. And it only takes one episode. You got to have it during that episode, that first episode. You often don't get the warnings. You don't have repetitive. So you don't realize the importance of carrying with you the nitro and the ASA. You're at an event, you're at a football game, a hockey game, you're having fun, and you've left it at home. Well, yes, with diabetes or if you have asthmatics, they're more attuned that they need that with them. But we need to realize that healthcare professionals should be carrying this or when episodes occur on airplanes or in public places. And the patients need to realize, you need to emphasize with your patients that this is a necessity for them to carry. And it's easy to carry. And, there's 100 billion aspirin tablets consumed in the world every year. 100 billion. Carry it with you. Carry it with you. It could save your life. It could save the life of someone that you know and love. And minutes matter. Those crucial first minutes, if it's available, it's going to make a difference on how well your outcomes are. And without it, how poor your outcomes are. And we have saved lives in Canada. It's also available through Amazon in the US. We'd like for it to be available worldwide. Worldwide, that people should be carrying this and it should be known. It's not just Canada where people suffer heart attacks. It's an affliction. You look at the statistics worldwide, people should be carrying ASA and nitroglycerin wherever you are. First responders need to be carrying this. It needs to be in first aid kits. And we could make a difference. Collectively, we can make a huge difference. We could, have better outcomes, and then we could actually save with these, relatively very inexpensive medications. We could save all our healthcare systems, billions of dollars if we could treat it early. Minutes matter, need to carry it, and we need, all healthcare professionals, nurse practitioners, pharmacists, medical physicians, those are in training, not just the cardiologists. Cardiologists actually understand this, but, primary care carry this. You have a risk factor of cardiovascular disease. You have a family history. You're over 55, you're diabetic, you have high cholesterol, smoker, you have a risk factor. You are, potentially you could have a heart attack. Carry this. This will potentially save your life, and it will certainly improve your outcomes.
Absolutely. Thank you for that. And just, for those listening and watching, this is a serious thing because we have that this product has been medically peer-reviewed and published in the Canadian Medical Association Journal. It has FDA clearance for sales in the US, and it is sold currently, if I'm not mistaken, in over 200 Canadian pharmacies and online. And you said Amazon too, I heard that. So it is kind of widely accessible to the public, which is great, honestly, because this is, again, CVDs, cardiovascular diseases, heart attacks. It is the biggest cause of death in our Western societies. So moving on maybe to the future a little bit with the time that we have left of the smart card. Now, we talked a little bit about where it's sold, so if we go into the future plans, I'm guessing that the whole point of this is to prevent people from having complicated myocardial infarctions, or saving lives, where minutes, like we talked about and like you guys pointed out so beautifully, time is of the essence. We talked about the 10 minutes that you have the importance of carrying it around. And just to touch on that before we go to the future of the smart card, and you'll be hopefully telling me all about it, but in your study, in your case study, if I'm not mistaken, there was actually an 86, please correct me if I'm wrong, but an 86-year-old man that was suffering from an angina or a chest pain. And it improved the outcomes for him as he was using the smart card, if I'm not mistaken. So I will link to the studies for people to watch so they can read them and review them properly. But it seems to also be indicating to prevent complications, like really hard complications of myocardial infarctions, at least for these 86-year-old men. And so it was, just to double check, it was an 86-year-old man, if I'm not
Yeah.
mistaken, from the first study. Yeah.
Yes, and he was at church, and he developed chest pain, and left early, went home, and he kept the contents of the smart card, and he had much better outcomes than he would have if he didn't take it. It saved his life. We have reports almost every week of individuals, often in rural locations where there isn't access to immediate access to healthcare. We also have reports every day. We publish that case series, but it continues on. People call in and thank Smart Card for saving their lives and telling us their testimonials, telling us their story. People at sporting events. We have hockey players who have had it on the bench and have had a heart attack during a game. So all the stories add up, and the Dame receives phone calls on a regular basis of people that have used the smart card and are grateful for it. First responders that have used it on airplanes, and we just like to get the word out, and we, having partners worldwide that would disseminate the card is, can save lives, make big difference, and prolong lives and better outcomes for people all around the world. With products that are available, just be carrying them. And a lot of people, we all know people that are overweight, have, potential, are at a risk factor with a heart attack. Heart attacks happen, okay? But let's be best prepared for them. We're going to have better outcomes. But I think James will tell you about some of the testimonials and people. He hears the stories on the front lines. He gets letters and phone calls, emails. All the people that have used it and are eternally grateful for it.
It's if I could interject, we just here, I guess it was just a few days ago, we received a call from a guy whose employer had passed out smart cards to all the employees as safety awards. And the gentleman called me and told me he didn't work at that place anymore, but he carried the smart card in his pocket every day. And his mother wasn't feeling good. And he went over to check on her, and by golly, she had a heart attack right in front of his eyes. And he said he never thought he'd be a modern day hero, but he pulled that card out and gave her the contents. And she did well. She needed bypass surgery, but it saved her life. And I actually called the company who provided that smart card to that employee. And in telling them this, they told me they had another encounter the year before. Another employee had used the card. So they never contact us about it. So how many of these people use the card and we don't hear about it, right? We have a story of an ophthalmologist, like an eye surgeon, who was on a plane from San Diego to New York City, and the plane was going to make an emergency landing because one of the passengers was having a heart attack. And she called the stewardess over, and she was packing the smart card with her, and she actually administered the pills, and the plane went back in the air and carried on its journey. But we hear these calls all the time. That lady worked for Kaiser Permanente, a big insurance provider, runs a lot of hospitals in the US, and since then they've done a survey of the smart card. We provided them with a lot of smart cards that they can do their survey for it. But we receive calls all the time, of people who've used the card. Even Dr. Mackey, he used it on an airplane. A gentleman was having a heart attack, and he administered the pills to him. I've never had to administer my pills to anybody who's been with me yet, but I tell you, I'm going to give you a scenario. Just imagine you're at a beach resort in Mexico, and it's 2 a.m, and all of a sudden that chest pain starts. How long do you wait before you call 911? If you wait till that elephant is sitting on your chest, it might be too late. I tell you, there is some comfort knowing, and I hear this from a lot of people, there is some comfort knowing that they got that smart card in their hand. And if they're away from emergency care and they need to use the card, they will. But we receive calls all the time. And there's some interesting facts about heart attacks. 1/3 of all the people who suffer a heart attack don't live long enough to make it to the hospital. They pass away before they get there. And the other interesting fact is 50% of all people who have a heart attack have no prior symptoms. No prior symptoms. So I tell you what, you don't even need to have a risk factor to have a heart attack. And you never know when it's going to happen. But like I say, it's a difference between life and death. And I say, why take that chance? I do not go anywhere without my smart card. I don't. I hear all the stories. So
Yeah.
I don't go anywhere without that card.
Yeah. No, aspirin, as we know, is available over the counter, ubiquitously available all around the world. Nitroglycerin is available. It's available through your pharmacist. It can be prescribed. It's available. And, the smart card's a convenient way to carry both nitroglycerin and aspirin, but carrying nitroglycerin and aspirin, especially if you had risk factors for a heart attack, that's the important message here. It doesn't have to be a smart card, but realizing this can happen at any time when these medications can save lives, can improve your outcomes, and save the healthcare system. So we'd like it to be available everywhere. We would just like to spread the word and the realization to both patients and healthcare professionals. We need to make all our patients. It's sort of a call to action here. Make our patients aware of the importance. Make healthcare professionals aware of this importance, and we will make a difference. And that's why, I'm here today. We can make a difference just by this podcast. We're going to make a difference in some lives. But let's spread the word and, disseminate this to our colleagues, friends, and make sure that, that this is available. It is an excellent alternative to be carrying these medications, and you won't forget it, and it'll be there when you need it most.
The thing with it too is, like I say, a pharmacy chain A pharmacy chain with an online pharmacy. That's all it takes. We'd love to see one in the European Union, one of the big chains, or across Australia, but we would definitely like that. We'd like to spread this around and let people know we exist. Most people outside Canada don't even know the smart card exists, but when they hear about it, they're all wowed. Every single one of them, they're wowed with it.
including me.
So, yeah. So
That's amazing. And so, we're about to, we're reaching the end of this interview, but just to sum it up a little bit, the smart card, 4 aspirin tablets, 3 nitroglycerin tablets, clear instructions encased in PTFE to be resistant against extreme temperature changes, makes it more potent and inert. It doesn't lose its potency, let's say. And so I'd just like to finish with one final question, and that is, when will this product, have you started the conversation with pharmaceutical companies in Europe? Anything related to getting it out to Europe in general for people that are interested? Because most of my listeners are European as of now. We have Canadians and Americans too, and some people in Africa especially, and Australia. But have you thought of extending it to other parts of the world, and how is that going so far?
yeah,
James Stewart,
Yep. We have spoke to the manufacturers who manufacture the nitroglycerin. We spoke to the manufacturers who manufacture the ASA about the possibility of forming a partnership. But like I say, what we need to do is we need to be able to get it into a pharmacy who has access to patients. And that's how it starts. That's how it starts, that people learn about the card. Is the pharmacy has access to a lot of patients. The pharmacist knows that it'll help save lives. The doctors know it helps save life. So the first place for us to start is right there. And yes, we've had discussions, various places in South America as well, in Mexico as well. We've had these discussions. And like I say, in the United States as well, we'd like to get in with a big insurance company. And like you say, without the early intervention with ASA and nitroglycerin, once you have heart failure is very expensive in a hospital stay. So it costs insurance companies millions if a person has a heart attack. And you can understand how it'd help insurance companies if they gave out these cards to all their clients. Those who want to carry it, because it would actually save the insurance company a whole bunch of money instead of paying for the hospital visits. And like I say, we are here in Canada, so it's hard to reach out other places, and we're busy. Like, we're busy with all the things that we do, but we would love to hook up with a pharmaceutical chain across the European Union that could maybe take this and spread the word through Europe. That would be really amazing. We'd save so many lives.
and I'll be crossing my fingers. For in Northern Europe, we say that we're holding our thumbs, equivalent of crossing our fingers for this really great initiative, honestly. And I hope the little I can do of spreading the awareness of this. But I'd like to thank you both, Dr. Neil Davis and James Stewart, for this really informative, amazing interview. I wish you, both of you, luck with really promoting and your future endeavors with the smart card. I hope it really the word gets out there, because yes, to just conclude, the time is of the essence, and that little thing, that small little smart card that fits in the size of your pocket, it's just it's going to save lives. I am really confident in that it will do, based on the studies you provided and based on the design. I think it's a win-win situation for everyone. So again, thank you to both of you for participating in this podcast, and good luck.
Yeah, I think you got to the heart of the matter, and minutes matter. Smart card could save a life. Nitroglycerin and ASA, spread the word to all the healthcare professionals, and in Italy, and thank you for the opportunity for us to present to you today and just talk about what is a very, very important global health problem.
Indeed. Thank you.
Yeah, thanks for having us here today, Hassam. I am hopeful that some of the things we've discussed will bring more awareness about heart attacks and convince people to carry ASA and nitroglycerin with them in case they have a heart attack. So thank you so much.
Thank you to both of you. Thank you so much for listening to this episode. I hope it brought you a new perspective, a moment of reflection, or even just a little bit of joy. You can find the video version of this episode on my YouTube channel, links in the show notes. And if you enjoyed the episode and would like to see more, please consider giving it a like or leaving a review on Spotify, Apple Podcast, or on my YouTube channel. Your support really helps others discover my content, and so, again, thank you for listening and for being part of this. I'll see you in the next episode of Medicine and Healthcare Around the World.